Hi, I'm Dr. Rodriguez Feliz. I'm a plastic surgeon, board-certified plastic surgeon. We're here today performing a hair transplantation at our institution, Miami Plastic Surgery. I'm part of this group. It's four of us, four surgeons. Miami Plastic Surgery was founded by my senior partners, Dr. Carlos Wolf and Michael Kelly. And basically now we have grown to 3 offices in the Miami area, and we cover basically every aspect of plastic surgery from the hair to the toes. And today we're doing a hair transplantation using a new technology. It's called NeoGraft. So NeoGraft basically it's a technique to do hair transplantation. The main difference from NeoGraft to the old technique, or what they call the strip method, is that basically there's no scar with NeoGraft. So as you can see, you will see in a second, the machine allows you to harvest each individual hair follicle without having to use a knife to cut into the scalp of the patient. This basically has several benefits, and of course it will be less painful for the patient. But in a case like where we're doing now, where a patient had a previous transplantation with the old method, it actually allows us to use or harvest a larger amount of grafts if we use this technique, because it allowed us to use all the way, or the scalp all the way to the anterior part of the ear. And it's been in the market for approximately 6-7 years. It's a great technique. The results are very natural. So basically when he harvests the follicles, they get it suctioned into this reservoir here, and they are kept in a moist environment. And then eventually we change that, and we use them to separate it in the area. So basically, to guide you through the whole process of, if you're thinking and having a hair transplantation, what it entails. The patients usually will call our office, they make an appointment. We usually try to arrange them, within a week or 2 weeks, so that initial assessment. When they're in the office, the appointment itself would take about 30 minutes. The discussion initially is regarding the patient history. Why is he looking into having a hair transplant? We want to make sure that there are no other underlying medical problems, and that particularly in men, that the hair loss is a genetic component. And basically it's, once again, it's a team effort to give the patients the best results. We're now in the second stage of our procedure. We have performed the harvesting of the follicles from the back of the patient, and we usually provide them with lunch. And now this second part, it's with the patient in a supine position, which is a little bit more comfortable than before. We're going to proceed with markings. So, the best candidate for hair transplant is someone that actually has lost function of the hair follicles. So in my practice, I tend to classify the transplant patients in 3. So tier 1 is someone that comes in and it tells me that he's losing his hair, but you don't really see, a hair loss per se. That is someone that might be okay with just products and shampoos and topical products. And the tier 2 is someone that you can tell that they're losing their hair, they're thinning, and they need a little bit more than just the normal stuff. So that patients I tend to introduce into my protocol PRP injections. We do low light level therapy, which is the laser therapy. And there's a tier 3, which is patients that have already balding. They have spots or spacing that actually needs to be filled in. So for tier 3, which is the case of our current patient, the only way to improve their density is by transplanting the hairs from the back into the front, and those are the best patients for this type of procedure. So you can see now we're doing the insertion of the grafts that we've harvested from the back of the head, and all these purple holes are the insertions that we perform where the grafts are going to go. And if you get closer here, you can see how we need to have handle this graft very delicate so that they can survive. And we basically are using single hair grafts, so each of this follicle has one hair in it, and those are used in the hairline. And by doing that is how we will create a very natural hairline. And then the other grafts that have multiple hairs, either 2, 3, or 4, then those are used towards the back side.
Thank you for watching our video. If you feel like you're a good candidate for this procedure, please contact our office at 305-595-2969 or go to our website, miamiplasticsurgery.com. Thank you.